Heart attacks and strokes are two of the most critical cardiovascular events, both resulting from disruptions in the blood flow, but affecting different parts of the body. A heart attack or myocardial infarction typically presents with chest pain, often radiating to the left arm or jaw, shortness of breath, and cold sweats, while a stroke manifests through sudden numbness or weakness, particularly on one side of the body, confusion, difficulty speaking, or loss of balance and coordination. The treatment for either condition requires immediate medical attention, with heart attacks often managed through medications that dissolve clots and restore blood flow to the heart, and strokes treated similarly or sometimes through surgical intervention to remove the obstruction. Risk factors for both conditions include high blood pressure, high cholesterol, obesity, diabetes, and smoking, emphasizing the importance of a healthy lifestyle and prevention. Understanding these distinctions is not just an academic exercise. It can literally save lives by ensuring the right kind of care is given as swiftly as possible. Here's a more detailed exploration of the nuanced differences and commonalities between a heart attack and a stroke. Primary organ system affected, cardiovascular versus central nervous system. Determining whether an individual has experienced a heart attack or a stroke is crucial, since these conditions impact different organ systems and require distinct treatment approaches. A heart attack, a cardiovascular event, occurs when blood flow to the heart muscle is abruptly blocked, typically due to plaque buildup or a clot in coronary arteries, leading to tissue damage or necrosis. In contrast, a stroke affects the central nervous system and arises when blood supply to the brain is compromised, either by a blockage, ischemic stroke, or bleeding, hemorrhagic stroke, causing neuronal injury. The key difference lies in the primary organ system affected, the heart versus the brain. Prompt and accurate identification is essential because timing is critical in administering therapies that can minimize tissue damage and improve outcomes, such as clot-busting drugs for strokes and angioplasty or bypass surgery for heart attacks. Typical onset, sudden and acute versus rapid or gradual. In differentiating between a heart attack and a stroke, the onset of symptoms is a crucial factor. Typically, heart attacks are characterized by sudden and acute onset, often with chest pain or discomfort, which may radiate to the arms, back, neck, jaw, or stomach. It may also be accompanied by shortness of breath, cold sweat, or nausea. In contrast, the onset of a stroke can vary, presenting either rapidly or gradually, depending on the type of stroke. Symptoms such as facial drooping, arm weakness, speech difficulties, confusion, and visual disturbances can develop over minutes or hours. Observing these differences in onset can be pivotal in diagnosis and urgent medical intervention, since timely treatment is critical in reducing long-term disability for both heart attacks and strokes. Characteristic symptoms: chest pain versus neurological deficits. Heart attacks primarily present with chest pain that's often described as a pressure or squeezing sensation, sometimes radiating to the arm, neck, or jaw, along with shortness of breath, sweating, and nausea. In contrast, strokes highlight neurological deficits, including sudden numbness or weakness on one side of the body, confusion, difficulty speaking, vision problems, severe headache, and loss of balance or coordination. These symptoms arise because strokes stem from interrupted blood flow to the brain, while heart attacks are due to blocked coronary arteries. Recognizing these distinct symptom profiles is critical, as both conditions require immediate medical intervention, but different treatment approaches. Early identification and differentiation can vastly improve outcomes and survivability. Common risk factors: coronary artery disease versus cerebral vascular disease. Heart attacks and strokes share several risk factors linked to cardiovascular health. For both conditions, high blood pressure serves as a leading contributor, facilitating damage to arteries, which can lead to plaque formation. Elevated cholesterol levels are culprits in atherosclerosis, narrowing arteries and increasing the risk of a clot-induced event. Diabetes, particularly uncontrolled, accelerates damage to blood vessels, enhancing the chances of both heart attacks and strokes. Obesity and physical inactivity further stress the circulatory system, boosting the odds of these diseases. Smoking is another shared risk factor, causing systemic inflammation and vascular damage. Recognizing these commonalities is crucial for integrated prevention strategies aimed at reducing the incidence of these life-threatening events. Primary treatment approaches: reperfusion therapy versus thrombolysis or neuroprotective strategies. In the acute management of a heart attack, myocardial infarction, the cornerstone of treatment is reperfusion therapy, primarily through percutaneous coronary intervention, PCI, or less commonly, coronary artery bypass grafting, CABG. These procedures aim to promptly restore blood flow to the heart muscle. On the other hand, stroke treatment varies significantly depending on the type. For ischemic strokes, thrombolysis using alteplase, a type of clot buster, is the mainstay if administered within a narrow time window from symptom onset. In select patients, endovascular thrombectomy may be utilized. For hemorrhagic strokes, the focus shifts to neuroprotective strategies and surgical intervention to alleviate pressure on the brain and prevent further damage. Each condition demands rapid assessment and targeted interventions to minimize tissue damage and improve outcomes.